Hello and welcome to this episode of Crate Conversations. I'm very excited to be here today with Dr. Mehra. He is an interventional cardiologist at Hackensack Meridian Ocean University Medical Center. And we are going to talk a little bit today about cardiac catheterization in the laboratory over at the hospital and some of the things that you do there. So I guess my first question is, when people hear the term cath lab or catheterization, it makes people feel uneasy or nervous. So what is that exactly?
So first of all, thank you, Mayor Crate, for having me here. It's an honor to be here. Cardiac catheterization is a very common procedure in the setting of people having heart disease. Mm-hmm. We at Ocean University Medical Center have a comprehensive heart and vascular center which provides this service. We do cardiac catheterizations as well as vascular procedures. Cardiac catheterization is essentially taking pictures of the arteries of the heart to see if there are any blockages there. Mm-hmm. This is done, very, very minimally invasively these days. You can do it through the groin and the artery in the groin, or you could do it, most of the time we do it through the radial artery these days. Take thin catheters up to the heart, inject some dye, take pictures under an X-ray camera, and see if there's a blockage that is causing somebody to have anginal discomfort. Mm-hmm. Discomfort, or if they're having in the middle of a heart attack, we can see the blockage and fix it with tiny wires and balloons and place what's called a stent. Okay. And relieve their discomfort and fix the blockage.
Oh my gosh. So at what situation would, other than having are people referred to do that, or do they make an appointment on their own? Like, how does one get into, do I say I'm having chest pains and I'm wondering what this is, and can I make an appointment, or how would people really end up getting this done?
So great question. Most of the time, we see these patients in the office. Mm-hmm. Somebody comes, either gets a referral by their primary care physician, or they come to the office complaining of chest discomfort. The first step usually is a non-invasive workup, like an echocardiogram, which is an ultrasound of the heart, and a stress test to see if there's any kind of a blood flow problem to the heart. Mm-hmm. If the stress test comes back abnormal, we electively schedule them for a cardiac catheterization. Sometimes we take them directly for a cardiac catheterization. Of course, in the setting of a heart attack, we take them emergently for a cardiac catheterization and take a look.
Sure. And when you're doing, now I'm just going to ask a whole bunch of medical questions because I'm curious. So if someone's actively having a heart attack, is this something that you would still do to see what's going on before you actually my grandfather was the only person in my family that had heart issues. Yeah. And that was back in say the 70s and 80s. So obviously we're very technologically different now. So would you use this if somebody's actively maybe having a heart attack, or how does that work?
Absolutely. This is the first line of therapy these days for somebody having a heart attack. Mm-hmm. So we have our Heart and Vascular Center situated right above the ER at Ocean University Medical Center, where we've got direct access to the cath lab. Somebody presents to the hospital with chest discomfort. They get an EKG within 5 minutes. The EKG shows that they're having a heart attack. The ER usually activates what's called a code STEMI, which is a ST elevation MI. The cath lab team that is on call gets activated emergently. Everybody congregates to the ER/cath lab. The patient gets transported emergently to the cath lab, and we do a cardiac catheterization. And the first line of therapy is this. We take a look, what's causing the problem. We fix it right then and there. We meet national guidelines of opening up the blockage from the time the patient hits the ER to opening up a blockage. The recommended door to balloon time, what is called, is less than 90 minutes. So from the time the patient hits the ER door, everything happens very, very fast and rapidly, and we take care of the problem.
Okay. So now I'm picturing this all happening. You mentioned that you can do things minimally invasively. So if someone is having a heart attack, depending on what the actual cause is, you can do it without, like, actually, I want to say cracking open the chest. Like, I don't know, I watch ER, so that's like, but like, how does that work? Are all operations, do you have to actually do a full surgery, or can you do things without doing?
So majority of the stuff is done minimally invasively now.
That's great.
Or through interventional procedures. It is essentially a needle hole here, just like starting an IV, but in the artery. And in some cases, we still need bypass surgery, for which you have to, quote unquote, crack the chest open and do a sternotomy. But a majority of the cases we treat with interventional therapies these days. Now,
does this have anything? A friend of mine had issues with, I guess, the heartbeat more. There weren't any clogs, but it was more there was a electrical problem with the heart. Would this type of thing help with that, or help to see what that is as well, or are there other things that you do for that?
So in the setting of a heart attack, you are susceptible to malignant arrhythmias. If that is the cause, correcting the underlying problem usually corrects the arrhythmia. But if there's a primary arrhythmogenic problem, then there are other therapies that are used, and that is usually an electrophysiologist does that. There's the pumping system of the heart,
and then there's the
plumbing, there's the plumbing, and there's the electrical system. So, and we at Ocean University Medical Center can treat some of those as well, including implanting pacemakers and things like that.
Oh, fascinating. Now, you mentioned vascular before. This is going to show that I know nothing about the human body, really. So is there something different between vascular when you're doing this?
Yeah, so vascular specialists, vascular surgeons take care of problems that relate to the arteries in areas other than the heart. So the carotid arteries and abdominal aortic aneurysms, circulation issues with the legs. So we have a hybrid OR in our Heart and Vascular Center where vascular surgeons are able to do interventional procedures for the legs, for other areas in the body, as well as open surgeries for the peripheral vascular disease issues.
And so is that something you do as well, obviously? Or is that
to some extent, but interventionalists sometimes do some of those procedures as well. But we work in collaboration with the vascular surgeons at the Heart and Vascular Center.
And for something like that, you'd also get a referral probably from your doctor. I don't know that you'd go in with an emergent.
Sometimes those can be emergencies as well, which we're equipped to deal with at our hospital. But most of the time, yes, you go complaining of either leg pain or stroke-like symptoms, and you see a vascular surgeon for that.
So if someone needs a cath lab procedure for a non-emergency, what factors should they consider when choosing to go to you? What should they be thinking about?
So that's a great question. Basically, you want to be at a center of excellence, a center that is equipped with a comprehensive gamut of therapies that can be provided. Doctors that are experienced, a team that is well equipped to take care of pre- and post-operative issues and complications if necessary. So we have a great team of nurses, not just doctors, but nurses, cath lab technicians, X-ray technicians, who are very, very experienced and on a daily basis manage these patients. So you want to look at a center that is capable of providing all those services.
As I mentioned, I don't really have a lot, thank God, knock on wood, I don't really have a lot of experience with this, but obviously the technology is constantly changing. Do you see anything, more innovations coming down the line with regard to this?
So, this all started with angioplasty in 1977. Like you said, a lot's changed.
I remember hearing the word balloon around my grandfather,
So 1977 is when the first balloon angioplasty was done by Dr. Grunsick. And since then, obviously, we've come a long way and things have evolved. And things continue to evolve. We are looking into new therapies that are coming down the pike and implement them at Ocean University Medical Center. We can take care of some of the, for example, we can take care of some of the sickest patients who come in with what's called cardiogenic shock. We can implant mechanical support devices like a percutaneous LVAD/Impella device, where we can improve the pumping action of the heart and stabilize them. in the setting of shock.
Mm-hmm.
We have new therapies coming, including cutting-edge treatments for hypertension that are coming that we want to implement. We're also expanding the gamut of electrophysiology therapies, like we talked about for arrhythmias, that is coming down the pike. So we're very excited about that.
That's great. I always feel so lucky to live here in Brook Township, knowing that we have such a great hospital right at our fingertips. If anything happens, it's no more than 5 or 10 minutes away from most of the residents here. So
I've been at Brick Hospital for the last, now Ocean University, Hackensack Meridian Hospital. I've been here for about 15 years. Our practice is just down the road from Brick Hospital, and both my kids were born here. I trusted the hospital enough to.
Mine too.
Yeah, they're 11 and 9 now, so they were both born in the L&D unit at Ocean Medical Center. So I'm a big fan of the hospital, and excited to have an opportunity to lead the Heart and Vascular Center. Yeah.
It has been really great having you here.
Yeah.
Is there any other information you want to share about either your practice or anything going on at the hospital?
Well, not specifically just about the hospital, but in general, watch out for symptoms of cardiac pathologies, and if you have chest discomfort, shortness of breath, anything, there's very, very well experienced and well-trained cardiologists in the area. Seek out one of them, and we're able to provide and diagnose and treat, any kind of cardiac issues that the general population in Brick might
Don't
have.
ignore the symptoms.
Don't ignore the symptoms. Always watch out for symptoms.
Especially
Absolutely.
women. Women ignore the symptoms, I think.
Women and the elderly sometimes have atypical chest discomfort and signs. Don't get the classic heaviness in the chest.
Yeah, what do women get, just so we know? I'm sorry, because I keep hearing about this and I'm at that age.
Yeah, it can be just fatigue. It can be some shortness of breath. It can be just indigestion, nausea. A lot of things that people dismiss. But if you do have the risk factors, seek help. Look for a cardiologist. Get testing done. Make sure you're not missing anything.
That's good info. Try to find out ahead of time so that you're not worried at the end. Yeah. Well, thank you so much. I really appreciate you joining us today. It was a lot of great information for me as well. I love meeting new people and learning new things. So I appreciate it. Thank you.
I appreciate the opportunity to speak with you.
Great. Thank you. Thank you so much for joining us on this great conversation. And we look forward to seeing you with the next episode.